welcome, and thank you so much for being with us. Okay, today we have a very special topic, or rather a topic that many people actually has been experiencing, especially with our work from home situation that we have since beginning of last year. And our speaker for today, Mr. Clement Francis Xavier, he is with us here today. He has been with Gleneagles for the past, I think, for 15 years experience. Okay, maybe I can invite Mr. Clement to say a few words to introduce himself before he start his sharing for today. Thank you, Mr. Clement.
Hi, thank you, Amy, for the introduction. Hi, everyone. A very good afternoon to you. So just a little bit of background of me. I'm a physiotherapy, working about 15 years. With Gleneagles, I'm currently in charge for clinical head and also in charging for hand rehab, especially. Okay, I hope everyone is well, good. Okay, so for now, I think we're going to start with some poll questions. I think Amy will put it up. 2 questions, poll questions. So today my topic will be more on common hand injuries. Okay, so I hope you will start with some poll questions. There's 2 questions. See if we can answer it. Will be great.
Yes, I've just launched 3 questions. The first question, how many of you work from home? Okay, please select an answer whether that I'm working from home or I'm not working from home. The second question, how many of you have wrist and hand injury? Okay, you may click yes or no. And our third question for the poll is squeeze a ball for carpal tunnel syndrome. Whether can you do it or not? Yes or no?
So we just give some moment to people to answer. So while answering questions, so today I'll be focusing more towards to hand, okay, especially injuries towards to the hand. So the reason of the post we're doing, we just want to know like how many people like working from home or just stay in the house. Sometimes not necessarily you're working, but you're using a lot of the phones or, and some people experiencing some pain on his wrist. And the third question is like you squeeze a ball, okay, for carpal tunnel syndrome, can or cannot.
All right, for those who are joining us, just join us. There's a poll ongoing. There's 3 questions. Please answer the 3 questions that we have posted up.
Okay.
Yep. Okay.
Right.
So most 3 minutes. I think we're going to end the poll.
Yep.
Okay. Should we share results, Clement?
Okay, right. Sure.
Okay, the results is the first question. How many of you are working from home? We have 56% of our participants answered today that they are working from home and 44% not working from home. Okay, sorry, there's a spelling mistake there. Second question would be how many of you have wrist and hand injury? 26% of the participants here today answered that yes, I have wrist and hand injury, and 74% No, I do not have a hand or wrist injury. And the third question, squeeze a ball for carpal tunnel syndrome. 91% of our participants today, they answered, yes, I can do it. And 9% said they can't do it. Yep.
Okay, right. Thank you. Okay, right. So we're going to the topic as today I'm going to present. So before that, okay. So this is the outlines. Can everyone see my slide?
Yes.
Yes. Okay. So this is the outline I'm going to talk for today's topic. So where the first we're going to identify the pain at your hand and what are the causes. Second is like how to ease the pain to prevent this injury or pain at your hand. And third is exercise tips. So before to go further, so some disclaimer. So some of the pictures I took from Google image, and some of the exercises that you must always remember. If the exercises cause you pain, you have to consult the physio or the doctor or any occupational therapy. So, and then this one is just like kind of like sharing, just more on awareness. But if you find anything like exercises or any further pain, you have to consult your doctor or physio or occupational therapy. Cool. Okay. So as we did kind of like a small survey, so we find nearly about 56% of your guys are all working from home, then the rest is not working from home. So what happened is like now working from home, our ergonomics is slightly changed. So where our table, mostly we're sitting on a dining table or coffee table, or maybe in front of the TV. So everything will be adjusted. So that's why we have commonly a lot of like hand injuries. So if you see at the picture here, so this girl has been sitting on her dining table, so where body is not rested properly, the wrist is kind of like an awkward position. So this one of the causes can affect to the wrist or to the hands to get injured. And the second poll question asked like, how many people are you guys experiencing pain on the wrist? So a certain percentage say that you guys having pain on your hand. So later we'll go. So as I mentioned on the first my outline, so I'm going to tell you some kind of like diagnosis that you can able to identify by yourself. So I'm going to teach you some tips how to identify what problems you have, especially when you're talking about wrist. Pain over here. You can see my hand, pain over here, then pain over here, then pain over here. So you're going to identify, like today I'm going to teach you some tips how to identify what problems you have. So my first topic will be carpal tunnel syndrome. So I think a lot of people, viewers will know about carpal tunnel syndrome because you managed to answer some of them. I think nearly about a lot of people answer it. So the question and the third question I asked the poll, can carpal tunnel syndrome, that means you can squeeze the ball or not? Okay, so a lot of you guys answer yes. Okay, these are commonly, I'm not like commenting any physio, any therapies on that, but generally, I just want to touch a little bit of anatomy of what is in the carpal tunnel. So if you see, can you see my cursor here? The red color marks over here. So this one we call as medial nerve. Okay, medial nerve is one of the nerve supplying to your thumb, your index finger, your middle finger, and half of your ring finger. So this is supplied by the medial nerve towards your fingers. So you can see the blue in shape, that is like a tunnel. Okay, we call as carpal tunnel. So in that tunnel, not only the medial nerve are going through inside the tunnel, but also you can see like there's kind of like a white round in shape, a small shape over here. So that is we call as flexor tendon. So flexor tendon, the function of the flexor tendon is to grip. You can see my finger, is to grip your fingers. That's the function of the flexor tendon. Okay, so come back to the question I asked, can we do ball squeezing for carpal tunnel? So my answer is no. Why? Why the reason I say is no? Because you see in the tunnel here, so when carpal tunnel syndrome happen, there will be inflammations happening towards to the area of the tunnel. So when there's an inflammation happening towards to the tunnel will be in the pressure. That means in high pressure. So that's why it start to compress your medial nerve and also your flexor tendon. So whenever you do squeezing of your ball, this is called as flexion or bending of your finger. So I just show it to you. So when you start gripping, so it's creating more pressure or more tension to the flexor tendon. So the symptoms can be increased, can be more. Okay, so that was my answer just now. So in carpal tunnel syndrome, so what are the main causes or some other causes can happen? So if you go to Google, you can go to books, anything has been said that there's no any one reason or significant to say that, oh, because of this, that's why the carpal tunnel syndrome can happen. If you read, you can see pregnant women, people who are diabetic, people who are working from home, or people working in a desk job are commonly prone to get carpal tunnel syndrome. So today I'm going to give you a small kind of like a guide. So how this carpal tunnel syndrome can develop. So usually our neutral positions of our wrist is these positions, our wrist. So what happened when the carpal tunnel in these positions are in the relaxation position. So whenever you do work in these positions, okay, especially when you work in your laptop or you're working with your desktop, which is working on the keyboard, so it's closing the tunnel. So when it's closing the tunnel, when you start working out on your fingers, so it creates a lot of tension on your carpal tunnel area. So that can cause inflammation towards the soft tissue, which is your nerve, your tendon. So when its inflammation increase, so you're going to compress on your medial nerve. So the sign and symptoms, usually you'll experience pain on the fingers and numbness on the fingers. This now mentioned to you from the first thumb up towards to a ring finger. So these are the signs and symptoms that you can find. So how we know that we have carpal tunnel syndrome or not? So there's a few tests usually we'll do. Sorry. So they call as Clement test. So Clement test something like this. Can you see my hand? So you just make your wrist to kind of like bend with elbow 90 degrees bending and stay in that positions at least about 30 to 60 seconds. So what will happen is you will experience, if you have carpal tunnel syndrome, you will have feel numbness on your finger. Just now I mentioned to you the numbness on the fingers. That is one test you can do. Another test is tapping on the area that medial nerve is supplied, at the tunnel area. When you tapping, you will feel a current effect on the wrist, or some they feel at the fingers. Okay, so these are the two tests you can do to diagnose it. You have carpal tunnel syndrome or not? Okay, so when you have carpal tunnel syndrome, okay, some of it like when acute stage, what you can do is you can wear a brace. That you can see the picture I show it to you in the slide. So that brace is help you to maintain that neutral position of your wrist, not like extending. So because what happened is, you can see, okay, yeah, okay. So this is one of the wrist brace. So what happened inside the brace, there is a metal piece. So it will prevent you to further bending or behind, straightening up. So it's maintain you in the neutral position. Sorry, can you see?
Yeah, maybe you need to turn on your virtual
Yeah.
background.
Sorry. Okay, now you can see clearly.
Yes, perfect.
Okay, so in these positions, your wrist is in a neutral position. So it not like closing the tunnel. So there's a opening up on your tendon. So you still can able to work by using this kind of brace. So this is one of the way of using the numbness, the pain. Second, you can do taping. So usually we're using like a sports tape. So if you notice it in Olympic Games, a lot of athletes are using kind of tapes. So this tape, what will do, it will open up the fascia. Fascia, that means there's a covering of your muscle. If you know, if you eat chicken, you know, when you take out the skin, the clear layer before the meat. So that is we call as fascia. So what the tape do, it is kind of like a offload. So it kind of like pull up the fascia. So there's a room for the muscles to move. So this is one of the technique we will do in this hospital. Okay, next conditions I'm going to go is decurving, or we call as tenosynovitis. If I'm go so fast, please stop me. Okay, you can put in your chat box. Okay, so next conditions I'm going to go for decurving or tenosynovitis, where usually you experience pain in this region. So you can see I highlighted an orange color. So usually at the thumb area. Okay, so let me go on the anatomy part of it. So decurving, usually there's an inflammation on the tendon where there's a two muscles, okay, which is, you can see here, you can see my cursor here. So which is like attached towards your thumb. Okay, the function of that tendon, it make your thumb to be open and close. Okay, so usually this kind of injury will happen those who are using mouse. Okay, so you know when you're using the mouse, you're using this way. Okay, so you see, look at my thumb, so using this way. Okay, and not only that, those who are using phone, so using your thumb a lot. Okay, so what happened in this condition we call as decurving, overusing of the muscle, repetitive movement. So where there's an inflammations develop at the area, there's a white color sheet we call as retinaculum. So underneath, there's a kind of like small tunnel also over there. So there's a swelling developed on the tendon. So how we know we have this decurving or tenosynovitis on, sorry. So usually we call as this one test where what we need to do, we need to bend your thumb, okay, bend your thumb towards your wrist, towards your palm over here, and then clench, okay, clench. And by clenching, you already, if you have decurving, you already have some discomfort feeling over the thumb over here. So what you need to do, and slightly bend, it's like, just imagine you are taking the hammer, you're banging down. So that movements. So when you do that, you will have a very sharp pain towards your thumb region. You can see a lot of pain over here. So this is one of the sign of you have decurving. Another sign you can do where you can do kind of like a pressure on the thumb and try to lift up the thumb up. So same thing, you will develop the pain. So this is where you're contracting the muscles, you kind of like against the movements. So you will experience the pain. So this is how we know we have decurving or not. Okay, so to prevent this, so we have kind of like a brace. So the brace is like we call as decurving brace, or we call as thumb spica. Why they call thumb spica? If you can see, compared to the brace just now, I show it to you, and this one you can see there's a support on the thumb. My thumb is not able to move, so my other fingers can able to move. So in a way, this is like more on inflammatory issues. So we rest the thumb, but other fingers we can able to move. So this is in a way, well, easing your pain. Next, we can do same thing, taping, physio or occupational therapists will do this technique. Okay, taping technique, same thing. If you're notified here, over here, we rest the tendon. So the thumb can't able to bend down or too much extended. So we put in the functional position. They still can able to do work. Because a lot of people prefer taping because they can bathe with the tape. So they can leave it for 48 hours unless they don't have any skin allergy. Next one that you can modify it. Okay, if you see the mouse, this is called as a vertical mouse. So rather than we doing this movement, so the vertical mouse is going to do this movement. So this movement is basically more on the wrist movements. rather than this movement. So these movements, we're going to have a lot of injury, overusing on your thumb, especially the tendon I mentioned to just now. So, but this movement, when the wrist is movement, there's not much movements on the thumb, so you can rest it. This is another way also to easing the pain. Okay, next condition we call as trigger finger. So trigger finger is the conditions where you can see this is we call as the tendon. If you see, there's a long tendon over here. So there's a pulley. Pulley is something like a covering for the tendon. So it hold the tendon in a position. So what happened? There is an inflammations develop at the pulley so that the tendon can't able to go in. Just imagine you have a needle, okay? You want to put the thread in the needle. So if just imagine there's a knot in the thread, so you can't go in. So that's how the conditions we call as trigger finger. So they have stages in trigger finger. They have about 4 stages. So first stages we have pain, then second pain is more, and third you can able to lock. It is like a locking, but you can able to open up. Stage 4, which is you can't able to open up. So it's just bend like this. So you need to use the other finger to open up. And every time when it's closing and open up, you're experiencing a lot of pain on your fingers. And also at the, we call as A1 pulley over here, will be a lot of pain when you palpating. Okay, so how that we know we have this trigger finger or not? So usually we can do a bending test. That means you grip the finger harder and slowly try to open up. You will find a little bit of locking mechanism. Another thing that is like if you stage 3 above, to stage 2 to stage 3, and stage 1 usually you will experience a lot of pain. Okay, a lot of pain we call as at the pulley area, A1 pulley area, and very common happen at the usually middle finger and ring finger. Okay, so how to ease the pain usually if you're experiencing trigger finger? So even to just now I mentioned to you to carpal tunnel and then a deeper vein, you can do ice brushing. So ice brushing, that means you just take example, if you have like like when you buy nowadays like everything delivery to the home. So usually they give you like a sauce container, a small container. So actually you can put water, you can keep inside the fridge. So you can take it out, it's already become like an ice cube. So you can take that, just imagine this one is the ice cube. You can take it, then you can, if you have deeper vein, you can rub on this region to reduce the inflammation. And when you have carpal tunnel syndrome, so you can rub this region, okay? And then we're talking about trigger finger, you can rub on this region, okay? So this is the tips, okay? So next one, you can have like a customized spleen like this. So what we'll do, just now I mentioned, so usually inflammations will happen towards this region, okay? So this brace, it will kind of like lock this bending, so it will mention to you again. So just my index finger. So this brace will prevent you to go further bending like this. It will lock here. So it's still functional. You can still grip, you can still hold things, can work, but it just stop in this region. So where the inflammation will reduce. This is one of the spleen. Okay, next we're going to go for another conditions they call as TFCC, or another conditions we call as ECU tendinitis, where both having symptom where they're experiencing pain towards to the pinky, this area, the little finger, this area they will experiencing the pain. So this one usually commonly now currently I'm having a lot of patients who coming to me. Reason is because all now gyms all closed, so all start doing exercises in the house, especially push up, burpees. So they see online. So not wrong, but you need to know what is the correct method to do and everything. So before that, I want to touch a little bit on what is TFCC, what is ECU. Okay, a little bit of anatomy. So if you see in this picture here, okay, TLCC is mean that triangular fibrocartilage complex. if you can see over here, there's a small tendon over here. This is the soft tissue at your lateral aspect, we call as the pinky area, just beside, we call as radius bone at your thumb. The side, this is we call as ulnar bone, just towards to this region. This is where the triangular cartilage is being placed. Okay, this is the origin of it. So usually what happen when we do accessory like push up, anything, overwork, this TFCC can able to tear or injure. Okay, so this is like a common conditions where you over exaggerate your wrist. Another one, the same area where just a little bit lower at the base of your fifth finger, and it go along up towards your elbow. This is we call as ECU. They call as extensor carpi ulnaris muscles, where there's an inflammations develop on that tendon which is attached towards to your little finger, base of little finger towards to your wrist, this region. So you will experience some pain over here. So same thing, those who are doing workout, those who are doing like an example, like too much of weight bearing on your wrist, so especially during exercises, you can experiencing the pain over the wrist. Okay, so how we know that we have TLCC or we have ECU tendinitis? So usually for TFCC, so test that we need to do, we call as piano key test. That means, imagine normally we play piano in this way, isn't it? So we try to press it, press it. So when we press on the finger, you will have experienced some pain towards to the outer part of the wrist. Okay, so this is one of the tests we can do. For ECU tendinitis, extensor carpi ulnaris tendinitis, so usually we against the movements, especially turning out against the movement, you will experiencing the pain over here. Okay, so the difference between ECU and TFCC is, so TFCC is giving a kind of like tissue giving stability on your ulnar region, the bone or the side over here. So that is giving stability on the wrist. But the ECU muscles giving movements on moving the wrist up, these movements. So the two different things is, same thing, you have the pain over here, but when you have TLCC tear or injury, you will experiencing some clicking sound when you do turning, when you're opening a jar, when you're opening the door, you will experiencing some clicking sound, and also you have some pain. But in ECU tendinitis, you extend the hand whenever you want to do something in these movements, you will feel some pain. That is the two different things on TFCC and also in ECU tendinitis. Okay, so this is one of the brace we can buy online or you can buy in the hospital. So this is one of the TFCC brace. So usually TFCC brace, this kind of brace, we use it for people who have even TFCC also, we have degree of tear. First like injured, then after that partial tear and full tear. So usually partial tear towards to kind of like experiencing pain, we encourage them to use this kind of brace. So it brace will be stop you giving a bit of support. So whenever you do turning, whenever you're doing your work. So this is also to ease your pain. And second one, this is like those who have severe injury. That means there's a partial tear towards to full tear. So usually doctor will prescribe, this is like custom made splint. So it prevent you to turn your wrist. So you can do this movement, but you can't able to turn. So usually patients should be go on this kind of splint minimum at least about 6 weeks, so that the soft tissue will can able to heal. Another technique we can use it when it comes for physio occupational therapy, we use taping technique. So taping technique where same thing, it gives you support on your wrist. Then you can do all your work so you won't have much pain. Okay, so that's all. So just some tips I'm going to teach you on some exercise. Okay, so just now I mentioned to you the first topic on carpal tunnel syndrome. So you see example, mostly we working on the desk. Okay, at times even we cook, those who are housewife, we cooking. If the reach in more on like bending positions, you're going to cook. Same thing, you're developing a lot of pressure over here. So you know the test to do, okay, to confirm it, or you have carpal tunnel syndrome or not. So it's good, you can do, yes, spelling test, thanks Amy. So and then you can do some tapping tests, okay. So to ease, usually overworked on that muscle, the flexor muscles, usually you have like this kind of symptom. So some tips, you can have like a softball, you can have tennis ball. Okay, what you can do, you can just like the back of your wrist, because this is the where the muscles start from. So you can start massaging using the ball at this area, the thumb area. Okay, when you have bigger vein, you can massage on this area. Okay, so usually it works very well with this like tennis ball or softball like this. So just now I mentioned to you about carpal tunnel syndrome. So we don't encourage it to do more on squeezing movements where you increase the tension on the carpal tunnel. So rather than gripping, we do reverse way where we use the extensor muscles. We can use our rubber band to open up. So we can strengthening the muscles on the wrist and the fingers. So rather than you gripping, when you're gripping, more tensions will develop. Okay. And then talking about TFCC, usually TFCC, you will have experiencing pain over here. So to strengthen, so you can have kind of like a band like this, resistant band. So you can start workout by bringing towards to your shoulder, but make sure the wrist is straight, not like bending straight. Then you can do workout on stability on your wrist in this way. Okay, so and then mostly conditions talking about wrist or elbow. So we need to start strengthening on your proximal joint, especially your scapular muscle, the behind muscle, the shoulder blade muscles. So we need to start engaging. There's a studies have said that a lot of people experiencing pain on the wrist from the elbow towards to the wrist over here, usually because of the weakness of the proximal muscle. So you see what happened when we sit, we try to hunchback or trying to like not a very good ergonomics. Depends, same when you're playing phone. So if you try to notice it, if you put a mirror, you can notice it, or you can put your phone and record it, you can see. So mostly your shoulder is forward. So when the shoulder is forward, a lot of pressure developing towards the shoulder, and slowly the pressure will go towards to the elbow and going to the wrist. So that's how a lot of conditions can be happen, like injury towards to the wrist and elbow. Okay, if you heard about tennis elbow, golfer's elbow, so not necessarily you need to go and play tennis or play golf. You can experience this kind of pain because of that loading going towards your elbow below because of the weakness on the proximal muscles. And also same goes to feeding mummies. Okay, so some of them like pregnant women, they always experiencing pain because they say, oh, post delivery or during pregnancy, I experiencing carpal tunnel syndrome. So basically, not a significant kind of like studies are proven to say that all pregnant women have carpal tunnel syndrome. Basically, I will say it's like more on the wrist positions of them, because all the time they not been carrying. Just imagine the baby is 3.5 kilo or 4 kilo, depends on how big the baby, and you constantly bending your wrist like this and feeding the baby. So what happened? Too much of pressure happening on the carpal tunnel, then you can experiencing all the carpal tunnel syndrome. Okay, so I think that's all from my side. Thank you so much. Any
Thank
question?
you. Thank you, Clement. It's very fascinating to see so many different types of common hand injuries where when you mentioned earlier that it actually starts from the back. It's a lot about our posture, right? When we, type or we look at our phone, is we lean forward. That's why it slowly reach to the hand. I have personally witnessed someone with a very severe trigger finger that the finger just cannot go up. Yeah, and I like that you use the ice to you were saying that to actually to reduce the inflammation. So it's actually a very good tip. Okay, we will reply the questions in the registration form first for our guests today. If you have any questions, please feel free to type in the chat box, and Clement will reply them later. Our first question that we have in the registration form is, I have osteoarthritis on my hands, and how do I prevent the condition from getting worse?
Sorry, Amy, can you repeat
Yep.
the question? The line
Yes.
is a bit breaking.
Yes. I just saw that. I think it's a bit freeze. Okay. Question from the registration form. I have osteoarthritis on my hands, and how do I prevent the condition from getting worse?
Okay, so osteoarthritis, thank you for the question. So osteoarthritis is the conditions that we call as degenerative changes on the joints. So osteoarthritis is like, you see, all our joints, we have cartilage. Okay, so cartilage we have on your knee, on your wrist. Okay, so what happens is the joint space will get narrower. So usually for osteoarthritis, I don't encourage them to do in closed position. Closed position, that means, like push up. Okay, anything in closed positions, we don't encourage them to do. So usually in degenerative changes, especially on the wrist joint, okay, very commonly happen. So I will encourage them, you can give some heat treatment, because heat will increase the blood circulation on that area, and you can do strengthening exercises without loading. So you can do strengthening, you can use the rubber band, you can use the squeeze ball, even you can use like a dumbbell, or if you don't have dumbbell in the house, you can use a mineral bottle, slowly, gently bring it up and down. So you need to strengthen up the wrist joint. But come back, if you're experiencing a lot of pain while doing the exercises, if you ask me personally, you need to see the doctor, so, or physio or occupational therapy, to identify why the pain is. Even when you do exercises, there's a pain. So I will advise them, mostly for osteoarthritis, don't do anything in closed pack position. So try to do in open position, which is like rubber band, dumbbells. Okay, that is strengthening the wrist. For pain, you can use some heat pack.
Okay.
Thank you.
So just now you mentioned that the closed type. What is a closed type exercise?
Okay, closed type exercises, that means it's like, you see, imagine you do a push-up. So when you do a push-up, so what happened to your wrist joint is in the closed pack position, in the closed pack positions where your top bone and the bottom bone are rubbing together and you are bending. Example, you do a push-up. So I don't really encourage to do anything closed pack positions where the joint is like come nearer compared to this way or this way. Okay, so this is we call as closed chain position. This is called as open chain position.
Okay, open chain position would be you are not in contact or something. Is
Yes.
that because in contact, let's say you do push up, so you're actually a close type, but open would be like you say lift up weights. Okay,
Yeah.
all right. So you're not in contact with like a hard surface.
Yes, correct.
Okay, and what's the difference between using a heat pack and using ice, a cold compress or a cold pack?
Okay, good question. Okay, there's a lot of like a controversy between hot and cold. Okay, if you go to cryo practitioners, they believe on ice. When you go to physio, hot pack. So what is my advice is, okay, so back to physiology of ice and physiology of heat. So ice, what will happen? It will contract your artery. Okay, so it will kind of like squeeze out. Okay, your arteries out. So for heat pack, it vasodilate. You dilate your vessels. Okay, so a lot of blood flow will go towards to the area. So usually in acute stage, you already know, and if any injuries, a lot of blood flow will be going on the area. So that means there's a lot of like a bleeding happen. Okay, a lot of like a small micro tear on the soft tissue will happen. So, and when you touch, will be slightly warm. So that is acute stage within about 48 hours. So I will encourage it to put ice. Heat pack, we use it for example like degenerative issues, muscle aching, this kind of things. So I will encourage it to use hot pack.
So hot pack would be for like mentioned dilation is more for ache, muscle aching, whereas ice pack, which is cold, is more for inflammation or
Yeah, like a
swollen.
sprain just recently happened. Yeah.
Okay. All right. Because from what I experienced, I think most people advise I heard is actually using ice pack. So sometimes, not sure what to use. And there were also situations that first use ice pack, then later use hot pack. So I don't know whether does it work. I
But
think
it's no harm by using combination, because when the patients come with the pain, like very acute pain. So some, if like patients who are elderly patients, they're very sensitive on cold. So although they just sprain, so no harm by giving ice and hot. So usually like some patients, example, when they come for trigger finger, when they come to us, So usually I'll start them with wax treatment. So wax, then like you go to like manicure, pedicure, we do wax. So same thing. So we do wax. So after exercises, everything. So why do we do wax? Is to make the tissues to be softened. So after the exercises done, so a lot of friction happening on the tendon area. So at the end, I'll give them a little bit of ice brushing. So I take the ice cube, I will brush towards to this area. So then it will ease the pain. So it's no harm. There's no right or wrong by using ice or cold pack. But theory behind it, that is the theory I mentioned to you just now.
Okay, thank you for your clarification. Second question we have from the registration form is it's actually quite a long question. My fingers are often numb and still, especially in the mornings. Inner arm still painful, wakes me up at night. What should I avoid doing? Any exercise recommended? Have hand pain on base on the thumb, index finger, crook of elbow. What can to be done to relieve the pain? Stiffness and sometimes swollen, especially in the morning. So I think it's the overall hand.
Yeah. So by seeing the symptom, it's look like carpal tunnel syndrome. Okay, so because mentioned that having numbness, but the numbness it depends. If the numbness is just these 3.5 fingers, is more effects by the medial nerve. If it's more towards the pinky area, this small little finger, so this one's caused by ulnar nerve. So usually a lot of people experience like sleeping in this position, okay, or hand behind the back. So there's a lot of compression happen in the elbow region over here. So where we call as, this is condition we call as cubital tunnel syndrome, where the ulnar nerve, like like the carpal tunnel syndrome, same thing. There's a tunnel over the elbow region we call as cubital tunnel. So there'll be a compress on that nerve. So usually people who like to sleep like this, bending the elbow, and even people who are working in the desk where not proper support, the edge of the table, anything compressed on this region, they will experience numbness. So usually they will do this kind of movements. Every single thing they do this kind of movement, they feel a bit of ease. So back to the question. So if the numbness is developing towards to here, is based on the ulnar nerve, but more towards to 3.5 fingers is more on medial nerve. So usually why it at night only happens? So not sure, maybe the positions of the hand slightly bent. So usually I will advise them to kind of like just imagine this is like a towel. So over here, you see, elbow region over here. Then you can take one cloth, just wrap it, so it prevent you to further bending. So you can put the arm in straight position. Then you can see in the morning you still have the same symptoms or not. If you're still experiencing, I'll say go back to doctor and check. So sometimes they call as Lasseter syndrome, where soft tissue over here. So because medial nerve is coming from the neck, and from here, that's how it's facing towards to the pronator muscles, is going towards to your wrist. So sometimes there'll be a compression on this region. Okay, so it's better to go back to the doctor and get a proper diagnosis.
Okay. All right. So our guest that asked this question maybe can try to do a wrap on the elbow. Okay. Hopefully that will work or not. I will advise to see a doctor. Okay.
Yes.
Our third question. Third question from the registration form, okay, would be, I had mastectomy surgery in 2016, then underwent chemotherapy and radiotherapy completed in 2017, so far fine. But in 2018, I underwent surgery again. And that's when I started getting hand pain, starting from a needle prick in the wrist, then swelling. After discharge, doctor referred to physiotherapy. First, he said the veins were swollen. For 6 months safe therapy, the swelling subsided, but the hand was still sore. He said the nerve was injured and was referred to orthopedic. And the doctor inject medicine and refer me to hand therapy. My question is the vein of the blade hand, okay, and the wound cannot be healed?
I really can't understand the question, because you see that first surgery was done mastectomy, then I believe went for some radiotherapy all. So usually radiotherapy will go on either this region or this region. Okay,
Yeah,
usually
that's right.
need to be very careful on the brachial plexus area. So where the nerve is coming from the cervical, from the neck region, C5 to T1 area. and it become like a plexus, the main branch of the nerve where the here, and is going under the armpit and is applying towards your hand. So what happened if, let's say, there's injury during the chemo or radiotherapy itself, it also can damage the nerve. So then patients went for second surgery. I'm not sure what type of surgery she went through, and then the nerve become like sensitive. Then she feeling little bit of like a knife cut towards to your hand. So that symptom is show more towards to the nerve. So I believe it is need to back to the doctor to check, is it the nerve is still damaged, because nerve, it will take some times to degenerate, although if his doctor example this nerve has been cut. So you see, we always work with hand surgeon. So they do under surgery. So they will join back the nerve artery. So when they already join back, so there's a top layer of the nerve. It need to be start growing. So every, like if not mistaken, every week there's a few will be start growing. So it will take time, at least about 3 to 6 months. The nerve, the top nerve covering will be start developing. So before that, they will still experiencing the knife cut pain. So you can talk to your physio, because doctor already referred to physio. Maybe you can try with some desensitizations on the wrist joint, okay, especially the nerve supply area. So usually my experience, I do experience patients who have this kind of symptoms. Usually I'll start with desensitizing the area. So like home remedy, we can use rice, the rice. You take the rice and just rub it to this area. Then you can take a cotton towel, you just can kind of like desensitize this area. So you can try a few techniques. If you're still not improving, you can back to physio to ask the opinion of the doctor.
Okay, thank you, Clement. So to our guest today, I think it take time for the nerve to recover, because Clement mentioned between 3 to 6 months, right? Or now you have to refer back to your physiotherapist. Okay, our next question is how to treat hand injury caused by a fall? Because there's actually so many type of different fall.
Yes. Okay. When you're talking about fall, there's a lot of mechanism. Depends on the fall. You fall from the bed down, or while you're running, you fall. So that's why, like, to prevent fall, actually is very difficult unless we're talking about elderly people in the house. So usually, I always focus them to be very careful, especially in the bathroom. Okay, and then near towards to the bedside, because usually the fall happen usually at night when they want to go to pass urine or pass urine usually at night. The bladder will be, because the muscle on the bladder will be weaker, so they will be very frequently go at night. So usually fall usually very common inside the bathroom, going towards to the bathroom. So I always encourage them to have like a cane, anything like that beside, or there's a small light, kind of like to have bright. And then in the bathroom you have something like a holding side railing. So this is to prevent. We're talking about elderly people. For younger group, or we're talking about people who are like doing exercises, all you need to be very careful on the wrist, especially your gym goers. Always put your wrist in neutral position. Okay, if you're scared, then you can put a kind of like a brace. If you notice it, some they have this kind of brace to wrap around on your wrist. So to mention, that means to maintain your wrist in a neutral position whenever you carry weights. You're talking about push up, you can use like a big dumbbell, like bigger dumbbell, so that your wrist in straight position. So you have something like a U bar like that. So you can hold it, then you can do push up. So you can prevent it injury towards your wrist. So these are the things, some of the things that we can do to prevent injury
Hello? 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 I'm not sure if I am frozen or our guest speaker is frozen. Clement, can you hear me? I think we have lost him. Clement, are you back? Yeah, I think you are back. Yes. I think you need to unmute. Okay.
Can you hear me?
Yeah, yes, we lost you for a minute. No, for a few
Okay,
seconds.
sorry.
Yes.
Yeah, so where I left just now, if you don't mind,
Just
then
now,
I can.
just now the question asked was that hand injury that caused by a fall, how to treat it?
Okay. So that's why I mentioned just now. Caused by the fall, it depends on the age group because see, if it's older age, usually, very commonly they get injured at home, usually inside the bathroom or the journey towards the bathroom, especially at night. Very commonly they get fall. Okay, so usually my advice is get bright light or just small light. It's like a bedside light to have to clear the path, and then to have some railing in the bathroom so you can hold. So that's another way to prevent fall. For younger age group, usually they'll get injured wrist during exercises. So one of it tips, like when you do push up, okay, don't get like a full push up like this. So you can get something like a big dumbbell, like a huge bit. So you can hold it this way, then you can do push up, or you can have like a U bar like this. If you go to any sports shop or online, so there's a kind of like a small U-shaped bar, you can hold it. So always remember, wrists need to be in neutral position. Even you carry weights, anything, wrists need to be in neutral positions. Don't do in these positions or these positions. Or okay, so even you can get some wrist brace to prevent injuries. So you can do so anything dealing with like other thing like sports. I hope now will be slowly people going to the sports. Be careful because sports injury you can't avoid it. Certain things, contact sport. So example, you trip and fall. So usually you can't prevent to like like bikers. So they've been learned technique how to fall to prevent injuries. But in sports for risk, it's no. So when you get injured, you need to see the doctor. But to prevent certain by doing exercises, and then by working on the computers. So these are the things how to prevent injuries on the wrist.
Yeah. Thank you for telling us so many tips on the prevention. But for treatment, would you suggest if let's say a person had a hand pain, would you straight away ask them to have their own self treatment, like either put ice or put a warm compress immediately if let's say they had this pain?
Good question. Actually, it depends. Okay, example, you got injured. Example, you're working out in the computer. So, example, like today, the whole day been working up towards the night. So then you feel some pain on your wrist joint, and depends. You're having pain over here or here. So there's now I mentioned to you some test. So you can try to do the test. Then okay, pain is over here. Might be you have deeper vein, so you can start some ice brushing. Then you can rest the wrist. You can get the wrist guard, anything, or thumb support, anything. You can get it first. So you need to wait for the next day. If you still pain persist, then you need to go and see a doctor. Okay, unless it's trauma, it's injury happened, so don't do your own remedy. Maybe you can start with ice, but of course maybe you might have a fracture. So because I do experience patients, so what happened is like chasing after the sun, then suddenly trip and fall with outstretched hand like this. So then experiencing a little bit of swelling over here. So he thought it's normal. He put ice, about 1 week he was okay. Then still having pain as eventually turning, rotation, but he still can able to do work, but swelling is still there. So he go to normal clinic. Then doctor say it's just a sprain. So what happened after about 2 weeks? Then he say no, pain is still there. So he went to a surgeon to see, and there's a small crack at the carpal bone over there. So doctor have to put a screw over there to make the carpal bone to be healed. So don't take it granted. So like when within 24 hours, 48 hours, pain still persist. So go and see a doctor to get the opinion, a good diagnosis for you.
Okay, so the key is between 24 to 48 hours. Yeah, because some people they'll observe it for 3 days, 7 days, 2 weeks. Okay, then my next question is actually a lot of people go to traditional medicine. You know, those traditional medicine where they will actually crack your bones, especially with what trigger finger and what frozen shoulder. What is your opinion about the traditional medicine on the effectiveness and whether, does it really help for someone for long term?
Okay, for me, I'm kind of a very neutral person, so I'm not commenting anything bad about traditional medicine, and modern medicine. So, what my personal advice to understand about your condition first. So you see, when you have example like trigger finger, you already know there's inflammation over there. So don't go and massage it that area. You already know there's already inflate. So don't go. You see, sometimes some people will take the pen and go and rub that area. So you already know there's inflammation there, and just imagine what happened to the inside structure is get more inflate, so more injuries will be happen. So I will advise to get a proper person to diagnose you, because now medical technology very good, very advanced. So even you can get a small ultrasound on that area, so you can see when you start moving the tendon, you can see the tendon properly glide or not. So not necessary you need to go for MRI. So some, like especially hand surgeon, they're very good. Even most some of the hand surgeon, they have their own ultrasound in the clinic, so they just can just do a small ultrasound over there, then they can diagnose you rather than you need to go to the MRI. So yeah.
Okay, thank you very much. Next
Okay.
question we have in the registration form is this person mentioned about butterfingers. Actually, what is butterfingers? Is that a term that been commonly used?
Some of them, they have like a butterfingers, they call it like a swan neck, or we have like a, it's kind of like deformity on the fingers. Okay, so so usually those, we have a lot of structures on the fingers. It is like the finger actually, like one of my hand surgeon, you always see that, just imagine this is just one knee, we have so many knees over here, so a lot of mechanism over here. So if you have injured on your knee, you still can able to go by wheelchair, but hand, no, you cannot. So it's a very complex kind of like a structure. We have tendon, okay, we have a pulley, we have ligaments, and then we have like a soft tissue around that. So we have, we call a central sleeve, okay, and then we have the lateral band. So when any of that soft tissue injured or there's a tear, so deformity will be happen, something like this. So that's why you need to properly being able to kind of like go to the doctor to diagnose it. Sometimes you have this kind of deformity. So usually there is a tear on your tendon or the lateral band towards to the side. So you will have this kind of deformity. So some people, they just go and start bending, but they will still have like this. So if it's just a partial tear, so sometimes the surgeon just put a kind of like a type of splint, they just straighten up the finger, so they will wait until it heal, then they reassess again. But in some cases, it's like tear is fully, so they have to do a small cut surgery to repair the central sleeve or the soft tissue surrounding that area.
Okay, so that deformity that have on a finger is called butterfingers.
Yes, it's kind of like a swan neck, or we have
Okay.
it's kind of like it's another thing. It's like a deformity on the fingers.
Okay. All right.
Yeah.
So the next question we have, we're actually replying the question in a chat box. Okay. How the tennis elbow occur? What are the pre-post causes? I have received 1 dose of a Syncord jab as too painful and was very painful after the injection. However, by attending physio now is much better. At times, bilateral elbow still pain, but it's bearable and I'm just ignoring it. Can it be cured?
Okay.
On tennis elbow.
Talking about tennis, yeah, when talking about tennis elbow, very good question. Actually, it's like a lot of people are like, I'm getting like, I can say average in a day, at least in 13 cases, maybe 5 cases tennis elbow. So I'm getting patients who are coming to me. So tennis elbow, you must know why the cause for you to happen. Either you're a sports person or maybe you're more on desk job person. So when talking about rehab, we're talking about tennis elbow, medical term we call as epicondylitis, or we call as extensor tendinitis. Okay, where the common extensor muscles, the tendon get inflamed. So when you're talking about tendon rehab itself, so we have phases of tendon rehab. So first phase is the acute phase where we have pain and everything. So we need to ease that side. Then second is the loading phase, where you cannot straight away load. So you see what happened. You can try to Google up and you can find about this lot of articles, a lot of studies done by Dr. Jill Cook, Jillcook. So there's a YouTube channel. So she's a physio. She did a lot of like tendon rehab. So you can just go and just see some videos on her. You can understand what is called as tendon rehab itself. So what happened when inflate tendon? So what happened actually, there's one of the scans you did, you see there's a lot of good structures developed at the inflate tendon. So what we need to do, we need to recruit the tendon. That means there's a lot of good structure surrounding that inflammation tendon. So we need to start recruit the tendon. So that means it's like we need to gradually load the tendon. So my experience, usually what I will do, of course, when patients come with the tennis elbow, and this patient has mentioned went for syncope injection. So usually syncope injection will ease the pain, but of course the pain is like it depends on each person. So some even like they have pain free for 1 week, some even 2 weeks, some even like 2-3 days. Then after that pain will come back because the tension is still on the muscles. So usually what I will do, I won't give treatment on that region that is this the attachment of the tendon, but I'll give treatment on the releasing of the muscles over here. Then gradually I give load to strengthen this muscle, and not only that, I'll start doing a lot of exercises on the shoulder blade area, because I mentioned just now a lot of tennis elbow happening because of weakness on the, we call as the name of the muscles, rhomboid, lower trapezius. So these muscles, if it's weaker, it pull your shoulder forward, so loading is going towards to the elbow. So can start some rehab on the shoulder blade muscle, strengthen. Maybe the loading will be lesser. So you can discuss with your physio.
There you have it. I think Clement have suggested that to do a shoulder blade muscle exercise, I think to reduce the load on the elbow. Okay, that's very useful to know. Next question we have, could I know some exercise tips for trigger finger other than applying ice on finger?
Okay.
Trigger finger tips, yeah.
Okay, trigger finger is depends on what stage the trigger finger you are experiencing. Okay, so this is some of the tips I'm teaching some of my patients. We're talking have trigger finger. So usually trigger finger, what happen is there's an inflammation towards to this region here. Okay, so what we can do, we can start doing a bit of stretching. So I always remember gun position. So remember you're holding a gun. So it's like gun positions. So your right hand is the affected finger. So you can use your good finger to kind of like push. Can I see my finger? It's like push. This is your effective finger. So you push, it's like you're stretching. It's like you're stretching back. Okay, so you can just hold there for about here. Okay, about 5 to 10 seconds. Hold it there for a while. Then relax. Okay, stretch, hold it there for a while. So you're just stretching this region here, the pulley region over here. Then after that, you can go for isometric exercises where same thing, you kind of like pushing back, but just bend the first joint. That means you do isometric, that means you against the finger. So just about same thing, about 5 seconds, then relax. About 5 seconds, relax. So just for the view, I'm just showing this way, but I encourage it to do in, the gun movements. Yeah, always remember do in that positions. So elbow is rested on the table when you do that. So this is some tips you can try. At the end, you can still do a little bit of ice brushing over here. Then try to not to move so much on this area. Let it heal. Let the inflammation to reduce. Okay, you still can do the top movements, not on here. So you can try.
Okay, wow, that was really helpful. Okay, because I'm also having a lot of hand wrist issue due to working from home. I noticed the time is 4:04. We're just going to go until maximum 4:15 because I know the Clement is a very busy man. Okay, so we try to answer as many questions as we can. If we cannot, then I will suggest that our attendees today, if you have a more serious matter, maybe perhaps you can make an appointment to meet with Clement in Gleneagles. Okay, next question that we have here is that from the chat box, I have a fall and have used my palm for support. Hurt the wrist area below the thumb, I guess, but now the pain surfaced. Yesterday, suddenly swollen and applied ointment and rub from the elbow to the wrist. I can feel my elbow pain too. So I guess he had an injury, right? Because he had a fall.
Yes, so same thing. My advice is, you see, you can do ice within about 24 to 48 hours. So back to doctor, please do check. Sometimes you won't know a small fall can have tendon rupture. Okay, so it's good to see the hand surgeon because they'll be very specific on soft tissue. So sometimes you won't have fracture. You do X-ray, you won't have fracture, but you might have soft tissue injury. You might have TFCC injury, a tear. So it is good to have a check with the doctor for further diagnosis.
Actually, this is a very good question. If someone have a fall and they have an injury on their hand, who should they see first?
Okay. So you see, this is like a more on, I would say, it's more on creating awareness. So you see, anything dealing with joint, muscles, any orthopedic can able to see. Okay, but specifically when talking about elbow below, so elbow below, so it's good to have. We in Malaysia we have not much actually in Malaysia, because I mean the Malaysian Hand Therapists Association. I'm one of the member over there. So we always been invited by the hand surgeon group in Malaysia, but not much hand surgeon in Malaysia. But now only is growing. So actually they started from Selayang, GH, then slowly now in HKL. So in government setup, if I'm not mistaken, is less than 20 surgeon we have in Malaysia. So, but in private setup, we have few number of full of doctors and surgeon. So my advice, if you find anything below elbow, you can see a hand surgeon. So not necessarily surgeon means, oh, you need to go for operation. So they can be very prescribed because they're very good in soft tissue. So anything injury on the soft tissue, they can pick up. So rather than you going like so many process.
So meaning anything below elbow, you can see a hand surgeon. Because sometimes a lot of people, they get very concerned. They say, see a surgeon straight away. I'm afraid that, I will need to go for an operation. So they probably see a GP first. Then do you recommend then that they go for, I don't know, a radiologist first, maybe to get a scan, to see an x-ray?
But it depends, you see, not all hand surgeon will request for MRI or any investigation, because it's their expertise area. So because their expertise area, wrist, fingers, below elbow. So by doing the assessment itself, they can pick up fast rather than they doing investigation much. So unless the patients who are consistently, they have pain even with physio, then they go for any further investigation.
Okay. Question we have in the chat box is that sometimes when I grip a gardening tool or a kitchen utensil for too long, my fingers stiffen up like a claw for a period of time. What's the reason? I think it's because lack of movement, and how to prevent this.
Yeah. So actually, back to all sedentary work or anything we do, anything in example, just go for marketing. So those who are going marketing, you're carrying bags with your fingers. So too long, you see, after a while, you can feel like the fingers is kind of like a bend. So very difficult to, then after like move a bit, then you can able to bend, because there's a consistent loading happen towards to the tendon. So same thing that mentioned just now, you use like scissors, anything, gardening tools, you kind of like holding, because you need to have some force to do that, and quite long you'll be doing. After a while, you kind of like feel your fingers are bent. Then after a while, then you kind of like open up. So if is that closing and opening up causing you pain, I believe you need to go and see a doctor. But it's just that movements only because it's loading too much your tendon. So have rest in between. Maybe you do some gardening here and there. So you just can do some fingers movements, then continue back. You can try that.
Okay. How frequent would you suggest someone who's in the sedentary position that they get up and they move their hands? Every 15 minutes, 20 minutes?
So usually like people who are working on desk, so I will say it's like ideally every 1 hour. So you need to just gently stretch your fingers, your wrist, then stretch your neck, okay, and try to roll. Okay, try to make a point that, okay, going to the loo or getting a coffee. So if it's in office, going towards to the photostat machines or fax machine. So changing position, because a lot of injuries happen when we constantly stay in that positions longer. Actually, human is not kind of like a machines. We can just stay there in that wrong positions too long. We have to do movements. We have to that means like reset back the loading. So you stay in that positions quite long, then the loading is too much towards the muscles. So then you need to start moving. So just imagine if you're just like looking at the laptop for a while. So what happened, that the studies are mentioned that just imagine the 5 kilo loads you're putting on the neck. So that's how it happens. So you need to take it out the load for a while, which is you can do stretching. So ideally 1 hour, every 1 hour you can do exercises. Unless you have symptom, maybe you can do half an hour. So I always mention to my patients, set alarm in your phone every 1 hour, because when you do twice on your work, very difficult. You'll be whole concentration. Those who are working with numbers, you need to be like really concentrate on that. So when you have alarm, so you have like, okay, I need to do stretching just within less than a minute, or maybe about 15 seconds.
Okay, that helps a lot with the alarm, or put a timer, put that 1 hour or 40 minutes, then you do a stretch. Because we also had a question saying that fingertips sometimes get numb, or when they type, okay, or tap on a mobile phone touchscreen for too long, or they feel stiff. I think it's the same advice that you would give, right? It's just make sure that you don't do it for too long.
Movements, deep rest. Yes.
Okay, so you have to get up and make a stretch. Next question we have is that my fingers get stiff when I wake up in the morning. Is this I need to be warm up before I can grab? Is this similar to the earlier question where the person probably in a sleeping position?
You need to know if it's like a very constantly. That means you need to see duration, how long you're having the symptom. If you're having the symptoms like more than about 1 month, 3 months, so you need to go and see the doctor. So it might be having some other issues. Some very commonly, those who have arthritis issue, they'll have stiffness in the morning. So sometimes they won't know. So when they go to doctor, they check the blood profile, then they get to know they have this issue or not. And those who have, like maybe you developing a bit of trigger finger, because trigger finger symptoms usually commonly stiffness in the morning. When you start moving, you'll feel okay. So it is good to just go and check with the doctor if that symptoms is like persist quite long.
Okay, persist, you mentioned for about a month. If you still cannot grab in the morning, then you should really see a doctor to see whether it could be an osteoarthritis, right? You say, okay.
It can be osteoarthritis, it can be trigger finger.
Okay. Next question. I had my trigger finger and carpal tunnel operation 3 weeks ago, recovering now, but I still have a bit of swollen on my finger and palm. Is this normal after 3 weeks?
Okay. So when you're talking about, that's a very, very good question actually. So when you're talking about process of healing, okay, so we have bone healing, we're talking about soft tissue healing. So I believe this patient went for carpal tunnel surgery and also trigger finger release. So when you're talking about soft tissue, it will take at least about 5 to 6 weeks to heal. So 3 weeks is still on the healing process. So try to avoid anything, because you really know carpal tunnels has been released. So that tension has been released. Of course, they have a little bit of swelling. So try to avoid a lot of forceful gripping position rather than active movements. If you remember the rubber band exercises, try to do that. Icing, okay, if it's necessary, get advice from the surgeon, need to use any brace or not. So usually 3 weeks, I don't really encourage them to do brace. So usually a lot of active movements. So do a lot of like tendon gliding, nerve gliding exercises, so that you can ease. But if you tell me 3 weeks is normal, but if it's more than that, if it's the pain is gradually is increasing, so better to see, get the advice from physio or doctor.
Okay. All right. Next question, and from the same person who asked the earlier question. Next one, I got to go for another tennis operation as arranged by a specialist. What happened if I delay the operation? If I leave it, are there any serious problem later for, I think, tennis elbow operation?
Okay, so it depends on of course, there must be a reason why the surgeon has been suggested you to go for operation. So either it's tennis elbow, or you have anything tear on that lateral epicondyle region, where the attachment of that tendon towards to the bone over here. So if it is tearing, sometimes the surgeon will advise you to go for surgery. But if it's tendinitis, it depends on the very chronic conditions. The surgeon might be encourage you to go for surgery, where for further rupture on the tendon. So when you rupture on the tendon, more damage happen. So that's why you need to discuss with your surgeon the reason why they need to do surgery. It's like more on the surgical method. Surgery is better advice. You need to go back to your doctor. So because it varies according to patient. So I can just give you a general advice. So it's good to go to the back to your surgeon. So sometimes, you have very chronic tennis elbow, quite long. The tendon is become thinner and thinner. You delay it, then you get rupture. So not good advice.
Yep. So I suggest to speak to the surgeon. Okay. Last
Yes.
question that we have, because already 4:15. When I am working on the PC using the mouse, I feel some pain in the bone at the edge of my hand, where it touches the edge of the table. I think it's the back. I try to shift the hand position from time to time to ease the pain. Is there a better way to prevent this? This is using the mouse, I think.
So it depends on which hand. If your hand is like a mouse hand, okay, try to have rest in between, stretch your hand, not too long. Okay, if you find that pain is more towards to the lateral aspect, this region here, more on the pinky region over here. So if you are developing numbness, that means there is one more tunnel over here we call as Guyen tunnel. Guyen tunnel is here and carpal tunnel is here. So Guyen tunnel, where this ulnar nerve is piercing towards to here and supplying this little finger and half of the ring finger. So usually I encourage it to start to do some exercises. Okay, get some nerve gliding exercises rather than just moving the hand. You won't see any difference. So rest in between, get some nerve gliding exercises, but still persist the symptom. Go back to your physio or doctor to see, to get an advice.
All right. Thank you so much, Clement, for your generous sharing and so many tips, okay, on the how we can prevent on our hand injury, and some of them who are actually facing the early stage of the hand injury. Okay, you can have some tips today to reduce that. Hopefully that can help us. Thank you so much once again, Clement. Really appreciate your sharing and a lot of your explanation today. So Clement is with Gleneagles, okay, and he's a physiotherapist in Gleneagles, and I'm sure he has helped many patients in ensuring that they have their mobility back. All right, so follow Gleneagles. Gleneagles is our generous sponsor, okay, for all our talks since in March, April 2020 until today. Today is our 25th episode. For those who have been following us throughout from last year until this year, thank you so much for all your support and for your trust. Okay, because of you, we are going strong, and we're still having our monthly virtual talk. All right, as long as we know that there's demand and we have the generous speakers to share with us. So thank you so much. Gleneagles, they have their social media in Facebook, in LinkedIn, and also in Instagram. Follow them to get more updates because they have a lot of interesting information available on the website. Huge thank you to our marketing team being with us here today. Gleneagles marketing team, Sarina, thank you so much for all your arrangement, okay, on our monthly health talk. All right, so this is actually our feedback form. Okay, please give us your feedback on what do you think of the talk for today. Okay, give us your comments, your positive comments for Clement, and we will forward to him, okay, once we get all your feedback form. All right, if you're unable to scan this, not to worry, we'll send to you later in your email. Okay. Yes, so the Pioneers Financial Services part of Prudential Assurance Malaysia Berhad, and Pru Wilson Takafu. And currently in September, Prudential is having a cashback craze that clients who sign up with us, they actually get cashback up to 1.5 month premium. So if you'd like to find out more, please approach any of your Prudential Wealth Planner that approached you today, or you can contact us to get more information. Okay, our next health talk is going to be on the 10th of October. Very nice date, 10-10-21. Sunday, 3 o'clock. It's usually the first or the second Sunday of the month. And the topic that has been requested in our feedback form was on dieting, on healthy eating by Miss Ti Hui Lee, a dietitian of Gleneagles Hospital, Kuala Lumpur. Please register, take out your phone to register and join us on next month. Okay, right. So this is me. Let's get connected. Follow me in your Instagram or Facebook because I updates on our virtual talk on every month, and also some information about myself, a group, and also on financial planning. And the group that supports me today with our co-hosts, okay, is the team, my fabulous team of the Pioneers Financial Services who are here with us. Okay, this is our team. The faces are here. We have a Facebook page. Okay. So this is the last slide for today on our feedback form and our next health talk. Thank you so much once again to all our participants who have been here with us. Thank you so much. And thanks again to Clement and Sarina, okay, our co-hosts. All right, so have a fantastic rest of the Sunday. Stay safe, take good care. Okay, I'll see you again soon in October. Thank you so much. Take care, everyone.
Okay, bye.
Thanks.
Be safe.
Thanks. Be safe.